Hello, I'm Dr. Garrett Christensen. Today I'm going to show you how to take care of your neck. So what can our neck do? Our neck can turn side to side, obviously. It can tilt side to side. It can go back and forward, but it can also translate and go side to side. It can protrude forward and it can retract back. And then those combinations together make circumduction of the neck, okay? Doing circular motions, right? So like a boxer. In order to take care of our necks, we have to move them in the planes that they were designed to move in. So let's get to it. See how far we should be able to move our neck with rotation. We should be able to go just about to where our chin gets in line with our shoulder, if our shoulder was relaxed in a normal anatomical position. So other side, going to the side, we should be able to go at least 45 degrees. This is 90, right? In between is 45. We should be able to go about 45 without the shoulder raising up and tilting our body with it, keeping our shoulders straight. Look in the mirror, see how far you can go. I can't go as far this way as I can that way, naturally, without pain. I feel a little bit of tension right in here. So we're gonna show you how to work that stuff out. Next one is check to see how far back you can go. Going back, looking up as far as you can. You should be able to do that with no pinching or no pain. And going the other way, dropping that chin down. Should be able to go down to where that chin just about meets that chest. We should be able to shift our head over to the side. Retraction and protraction. Protruding that neck forward and bringing that back. Should be able to do that with no problem. And then doing some circles. Quite often what we have when we have neck problems is our shoulders are too tight. Too many of us are driving. Our shoulders are forward, we're sitting on a computer, we're looking down at our stinking phones. We get this rounded shoulder posture, okay? And when we put our shoulders forward, it puts pressure on our neck and makes our neck want to come forward. Now, I'm exaggerating here, but that's what happens. We get stuck in this position here and our posture suffers, and pretty soon we develop neck pain. So what we want to do is we want to work first and foremost on opening up our chest. As we release the tension in our chest, we take the pressure off our neck. First thing I like to do is reach back behind you, open up your chest, look up, and breathe. Take our fingers, place them right underneath the chin, look up as far as you can. Use the breath. As you exhale, go a little bit further. I like to think of a color wheel from white to red, okay? White, there's no pressure, no pain, you're comfortable. Yellow, you start to feel a stretch. You start to feel it talk to you. Orange, it starts to get a little bit uncomfortable. Red, it starts to hurt. Stay within the yellow to orange region as we work through this. So going up, fingers under the chin, go as far as you can, showing you from the side here. And push back. Notice I can go a little bit more as I breathe. Another way of doing this is as you get up into that stretch, we're gonna diagonally angle our neck. Coming up and then slight diagonal one side and the other side. If you don't feel much of a stretch doing that, just stay straight back. Now the next thing is going hands back behind the head and just dropping that chin. And allow those elbows to fall down and just breathe straight down. Notice as we breathe, we're allowing the body to release a little bit more. We're not forcing, I'm not cranking, I'm not using my muscles to pull. I'm allowing the weight to gently open that up. Then we can laterally bend one way or the other. Hold there where it feels good. While you're in that lateral bent position or laterally flexed position, rotate the head as well. And fine tune where it is that your neck needs to stretch the most. Feel that tension, breathe into it. Exhale, let it go. You are in control of your body, so listen to it. Listen to what your body's telling you. Now, lean side to side. Rolling the neck out. One thing I like to do is if you're seated, you can grab onto the side of your chair and lean away. Grab on, lean away, let that shoulder depress, and then tilt your head to the side. And then breathe. And as you exhale, allow that shoulder to drop just a hair more. Allow that neck to open up just a little bit more. If you don't have a chair, just use your hand back behind you. Grab on to that hand and gently hold that down and then lean away. We can go directly to the side, which is great. We can go forward and then turn away. And feel that as you turn while you're in that forward flex position and that laterally flex position, rotate just a little bit and play with that rotation. You could also do a little bit of some circular motions. So showing you from the side here, I'm grabbing on back behind me, holding that down. As that shoulder's down, we're allowing that head to fall to the side. Breathing, let it roll forward, and then rotate a little bit. Now, we're laterally flexed, we're extended, and then we're playing with the rotation. Should feel that pull right up and through there. Through range of motion, we can apply pressure on wherever we feel tension. So this muscle right in the front here, the most superficial muscle, is the platysma. Put a little pressure right underneath the jaw. Just tack onto the tissue and lift up. And you can go one side or the other. You can grab on just one side, holding on and lifting and turning as you go. And let that slide all the way down to your clavicle, to your collarbone there. And lift and open up that space. Feel that stretch along that muscle. And you can do that as many times as you like. And that muscle goes all the way out to your collarbone, across to the center here, from the shoulder to the collarbone. It attaches right in through there. Other side, lifting up. We could go both at the same time. You can tack right onto the collarbone, right above the collarbone. Shorten the muscle by looking down, tack onto it, pull it down, and then lift. And breathe, and let that stretch. You can turn a little side to side while you're there. Another thing is our trapezius. This muscle right here, your upper trap. What you want to do there is you can reach across there, grab onto that guy, and you'll feel, as you squeeze that, little trigger points. And find where it's talking to you the most. Find which trigger point is the most tender. Hold it and breathe. You don't have to push hard. I'm squeezing about 50% pressure. And then you can turn your head a little to the left, a little to the right, and you'll feel that increase the tension as you do that. And you can also roll the shoulder a little bit while you're holding on there. The one thing I love doing is the shoulder rolls. Roll your shoulders, alternating together, old-fashioned shoulder rolls. We are mobilizing the shoulder blades here. As you do this, you can round the back as you go forward and then lift up. We're elevating, retracting the shoulders, depressing the shoulders all the way down and lifting the chest, and then allowing the shoulders to roll forward and down and then up. Take it slow, take it easy. No rush going through here. Use your breath. You can get the elbows involved. Next thing, huggers. Love huggers. Just bring those arms back and forth. You can start with huggers down low by your waist. As your arms come back behind you, they're right down by your waist. You can raise them up a little bit higher, a little bit higher, a little bit higher until you reach about shoulder height. You can do it with your palms down. You can do it to where your palms are facing each other inwards. And then you can do it with your palms up. And notice the difference there in your shoulder, in your chest, in your arms. Next thing is the good old-fashioned arm circles. Now, our shoulders are dynamic. So we don't have just one plane which we stay in. We don't just go straight out to the side and sit here and do arm circles right here. we want to take it and we want to play with different angles. Back behind you, out in front of you, down below, up above. I like to think about it if you are inside of a bubble and you are washing that bubble, okay? At all angles, get down in there, wash that bubble, play with it for about a minute or two. And then focus on your breath. You can alternate. You can have your elbows slightly bent with it. You can straighten them out all the way and reach as you go. Play with that. Be gentle with yourself. Listen to your body. You can do this one with palms up, palms straight in front of you, palms down, rounded forward, palms back behind you. So again, play with these motions. Then we can get to the full windmill. This should feel good. All right, so talking about our necks, but we're focusing on the shoulder because our neck and our shoulders are friends or frenemies, depending on the day and what's going on. So you can go back and forth between arm circles, huggers, all these different motions, full windmills. We can do alternating windmills. Frontwards, backwards. Now one that I really enjoy is called Black Dragon Hands. Hands out to the side. One arm's going back behind you as the other arm's coming out in front of you. And then it's basically like you're swimming, but then you're rotating the other way. So the arm that went behind you first is now going in front of you while the other arm swings up and back behind you. Again, coming behind, in front, behind, in front. Way. Now for one of my favorites, shakers or hoppers. Just go up on your toes and bounce on your heels. Allow your shoulders to just slop or bounce in that joint. Feel those tendons being tugged on. Shouldn't hurt. Elongate your spine as you do this. Another excellent way to take care of our neck is to use resistance. So our neck muscles quite often are just held into positions where they're constantly being activated and we don't even realize it. And so one thing that we want to do to optimize our neck performance is put your neck under tension. Go ahead and place your palm on your forehead and then use your neck muscles to activate forward. Use that palm to resist that motion. You can do both palms, you can do one palm, whatever feels comfortable for you. Hold for 1 1,000, 2 1,000, 3 1,000. Gently ramp up the pressure. And then, same thing, go backwards, the opposite way. Hold your hands, you can interlock your fingers and give a little pressure going back. Resist that pressure. And then we'll go lateral. Put your palm against the side of your head and push into it gently. 50% pressure, 75% pressure, 100% if you desire. I recommend starting off 50% to 75% and then working up. We also want to resist the translation motion. So if you put your hand on your cheek, it's a little different than if you put your hand on the side of your temple. Okay, so feel that resistance. Then we got protraction and retraction. So if you put your hands on your chin and try to push up forward, it's going to be different. And you're trying to here grab hold of your head and trying to go into that retraction position rather than the extension position. See the difference there? So extension, we're trying to hold that head from going back that way, and then retraction, we're trying to hold that head from going back that way. So it's going to activate different muscles. The next thing is using diagonal motion. So we got diagonal forward, diagonal back. So put your hand on the corner of your forehead and press down and forward in that direction. In a diagonal, same thing going back, other side. The last one we want to do is rotation. Put your hand on your temple and then rotate into it. Another simple yet effective shoulder mobility exercise is the old-fashioned karate class, martial arts class. Quite often you'll see them pull their fists up into the ribs, right? And when they do this, what we want to do is we want to get those elbows to come back and to almost try to touch them together if you could. So you're retracting your shoulder blades, you're squeezing your scapula together, and you're holding about 75% tension. Breathe, and then try to go a little bit more. We're also depressing the shoulders, so we're not allowing those shoulders to come up. We're dropping those shoulders down. Those fists are coming back into that rib cage as far as you can. Breathe and hold. Now, what is this doing? This is holding that shoulder girdle in a more optimal position. They go into a punching position. While the forward arm that's punching is there, the other arm is focusing on being back and strong. So come in here, punching, back and strong. So this, you want to give that an additional little squeeze. Get that into position. Go ahead and punch, and then pull that back and feel that other arm, your neutral arm, in a good firm position. And then also elongate your neck just a little bit. So lifting the neck, keeping that neck in a nice neutral position here. So we're not letting it hang out forward. We're not letting that chin drop down. We're holding that gaze forward, and our head is retracted just a little bit. Now I'm also not way back here. So there's a neutral balance point where our neck is active. I like to think if you had a string on the top of your head, someone's pulling that string up. So that's where you're gonna be. Here, self-check, get in position, squeeze that shoulder blade back behind you, elbow back behind you, hold that fist up into that rib cage, and let that shoulder drop down. The other arm, the punching arm, is as though you were pushing against the wall, leaning into the wall. How is your shoulder going to be to keep it most stable? How is your elbow and your wrist going to be? So lock those joints in place where they're nice and firm. And as you feel comfortable doing that, you can speed up the motion. Next up, we have internal and external rotations. So wringing out the shoulders. So as one arm goes up one way, rotating externally, the other arm rotates internally. And I like to turn my neck towards the side of the externally rotated arm and work with that breath. Get into position and try to add another centimeter of rotation. And you could do little pulses. You could hold, pulse a little more, hold, pulse a little more, and focus on one arm at a time, and then focus on the opposite arm, the internally rotated arm, and then work them both together. Another way of doing this is rolling both arms forward as far as you can, bending forward, allowing for that little bit of extra rotation. And then same thing, rolling them both up and out externally, bending back slightly, and getting a little added centimeter or millimeter of rotation. From the side, rolling forward, thumbs down as far as we can, bending forward, rolling those a little bit more. Same thing coming back. Open. Now I can play with my arms are out in front of me here, or they're straight out to the side as I'm doing this, or they're up a little bit or down a little bit. You can kind of play with that. You decide where maybe you want to go in all directions as you hold that. Another excellent shoulder opening mobility stretch is called the shoulder dislocate. Now I don't like this name because your shoulder doesn't actually dislocate when you do this, but it does go through its range of motion securely in that joint capsule, and it should feel really nice. What you do is you start with a wide grip, as wide as you can go, and come up and over your head with a staff, a broomstick, whatever you have. You can use a towel even. I like using something sturdy though. Feel like it's a little bit of a better stretch. Start wide, work it up and around. If that's too easy, come in just a centimeter or two. Do it again, still easy, coming in a little bit more. Okay, starting to feel a little bit of a stretch there, especially on the back side right there. I feel a good stretch through my front of my shoulders and my chest. I'm gonna go in just a little bit more, see if I can do that, no problem. You can add a little bit of extension into your spine as you do this. Being in a flex position forward is a little bit harder than if you're opened up. Reaching across, the old-fashioned stretch from the gym class, hooking that elbow. Now, from there, bring your hands up to where they are facing away from each other. Palms away, then reach underneath and grab that thumb from the inside. Right here, we are now pulling that elbow across to the opposite side. So right here, across to the opposite side. Got that elbow, pulling it away from, feeling that stretch right through that shoulder there. Now to take this one step further, we can rotate that arm. We can rotate just a little bit and pull it across. We can rotate a lot, pull it across. We can pull that elbow directly across to the opposite shoulder. We can pull it up and across. We can pull it down and across. Okay, now if we want to get that a little more advanced, we go down and take a knee. Right now my right arm is hooked inside and I'm getting that stretch on that right shoulder. Left foot forward, left knee at a 90-degree angle, and I'm going to lay down that elbow, that arm across that knee and breathe. Let that stretch. Show you what it looks like from the other side here. So I'm going to do my left arm inside, hooking that left arm, getting that elbow seated deep inside that other elbow, reaching across. Right knee is bent, left arm on the inside, leaning towards that right knee. And breathing. Hook that elbow, come up, palms facing away, reach up, grab that, lean over across that. The next stretch is the old-fashioned reach back behind you, clasp your hands, pressing those palms together, lifting your shoulders back, chest up, looking up, and lowering the hands down and depressing the shoulders. And slowly lifting that sternum a little bit higher and squeezing those shoulder blades together and down a little bit more. Each breath you take, work into it a little bit more. We're not forcing. Lift your spine through the neck. Let your collarbones open up. You can squeeze as you get lower. Squeeze your glutes a little bit and arch your back. Looking up. Squeeze those shoulder blades together. And coming out. Just challenge yourself as far as you feel comfortable. Don't go into the pain. If it hurts, come out of it. Just go as far as you can and work up to it bit by bit, and you'll be able to take it all the way down. Now, the really advanced people can go all the way into a back bend from that position. I'm not there yet, but this is a great way to open up that chest. Again, the palms together, fingers interlaced. Holding that firm pressure. I'm not squeezing super hard, but we're holding good pressure there as we rotate here, lifting the chest. Now from here, widen your stance. Step your feet apart from each other, about shoulder width, 1.5 times apart. And we're going to get in that position, and then we're going to lean forward and let those arms come back behind you. We're leaning. The next stretch, very basic, simple. One arm up behind you, try to touch your spine, other hand grabbing that elbow, pulling it across behind the head, and then using that head to straighten that out. I'm gonna reach up, grab that spine, try to touch that spine, reach back with the other hand, grabbing that elbow. I'm lifting my head or allowing my head to flex forward a little bit to get out of the way so I can get that shoulder up into the optimal position. Hand on that spine and then working that back, working that head back. This next stretch requires a chair. You're gonna reach your elbows down on the chair, and then you're going to put your hands together, drop your head. You may need to flare your elbows out a little bit more. Drop your head down below your elbows. Allow your lower back to arch. The next exercise that will help our shoulders dramatically is the crab or the table, however you want to think about it. What you're going to do is put your hands down back behind you, underneath your shoulders, feet out in front of you, knees bent, and bridge that pelvis up as far as you can comfortably, allowing the head to relax into those shoulders. And breathe and lift your shoulders a little bit more, lifting that chest, squeezing those shoulder blades back behind you. So notice you can sink down into that shoulder girdle, allowing a little bit of a stretch to occur, and then you can roll those shoulders back and lift. You can let your head relax back, or you can elongate your neck, holding yourself up. You can focus on just your shoulders at it, or you can lift that pelvis with it, right along with it, squeezing those glutes. A little more. Now as you breathe, when you exhale, shoot for another centimeter. Take a break, come down, pull your butt back in between your hands and lift for a second or two, and then come right back up into your crab or your table and work with your breath. I like to do about 5 breaths. You could do more, you could do less, whatever's comfortable for you. Now you can come here, hold, lift your feet up off the ground, or keep them down. Back into it. You can put a little more pressure on one side or the other. Listen to it. You can do little shoulder rolls, whatever feels good. You can keep your pelvis sag down while you press up. Then you can bring that body forward a little bit, allowing a little bit more strain on the anterior portion of that shoulder, and then lift. Come back to where you're stacked right over it. Make it the opposite way, as though you were doing a dip motion. So play with it. Your shoulder is the most dynamic joint in your body. You can play with having your palms straight out to the side, back behind you. If your wrists are flexible enough, or pointed towards your feet. Play with that rotation of your wrists. Feel where it's most comfortable for you and work into all different angles. Give your wrists a rest and bend them backwards the other way. The bridge or the wheel or the back bend, how do you want to think about this? What we're going to do is you're going to lay flat. You're going to place your hands upside down, fingers pointed back towards your feet. Breathe, feet flat against the ground. You can go up on your toes, and we're going to bridge up with the pelvis as we push with our hands at the same time, and we're going to lift back up onto the crown of the head. If it hurts your neck, don't do it. I'm going to bring my hands in a little closer and then press up. Going up on my toes is easier. Allow the head to fall back and relax, and then drop down to the heels. Activating the glutes and the back and pressing through. Use your breath. You can touch your crown of your head, come back up. Touch, back up. You want to get crazy with it? One leg up. Other leg up. Coming back down, rolling onto the back of the head, into the shoulders, and back down. Good job. From here, I like to just tuck, give a little roll, and or grab one knee at a time. Give it a little love. Both knees. Rolling up, protracting our shoulders, retracting our shoulders, looking up, arching the back. Beautiful stretch. We can sit back a little bit, but towards the heels while we do it. We can stay up, stacked over our wrists with our shoulders while we do it. We can do an in-between spinal wave. Drop our head down and allow your head to gently rock side to side while you rotate. So there's some coupled motion going on here. We're rotating as we're laterally flexing each way, and give it a little S pattern, figure eight pattern, however you want to think about it. Go as far to the side as you like. And you could add your whole spine if you want, or just keep it in your neck. You can shorten it up so it's a very narrow motion, or you can widen it out. Another great stretch is to drop the head down onto the crown of the head and allow the body gently to roll up over it to where the crown, where your cowlick usually is, comes in contact with the floor. So going to the forehead, rolling gently. Now I'm not putting pressure on my head. I'm using the floor to help roll that chin down. Each time I'm going just a millimeter further. Listening to my body, what I'm capable of. Hey, thanks for watching this video. I hope you enjoyed it. I hope you learned something new.